Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insight segment. I'm Harold Fisher. Addiction doesn't care about your zip code. It doesn't care about your job title or your family history. It affects our neighbors, our coworkers, our loved ones, and yes, even ourselves. Well, tonight we are talking about addiction recovery and the road to treatment, from opioids to alcohol to prescription drugs. We're talking about all of the things that encompass this very serious issue. We're looking at the personal, medical, and the social challenges of breaking free. Now, joining me are voices from the front lines of this crisis who are helping individuals and families survive. This is about healing, hope, and some very hard truths. My guests are Dr. Ebony Caldwell, addiction psychiatrist and clinical assistant professor at the Howard University Department of Psychiatry, Dr. Siva Kalamurthy, a child and adolescent and addiction psychiatrist. He's also a clinical assistant professor at the Howard University Department of Psychiatry, and Daphne Jordan, a peer recovery specialist and recovery guest at Howard University's Department of Psychology. So obviously you all are running into each other just about every day, I would imagine. Thank you all so much for joining this really important conversation. I think before we get into the nuts and bolts of this, I wanted to ask each of you, and I'll start with you, Dr. Caldwell. I want your reaction to the incidents, plural, incidents that happened in Baltimore over the past couple of weeks. As you know, there were 2 weeks ago, 27 people had overdosed in the Penn North community. About 10 of them were in critical condition. And then it happened again just last week, another 5
Mhm.
impacted by what officials believe is the same substance. Your thoughts about that?
Well, I would say that it's definitely alarming, but it is not surprising. We know that there are so many different substances that are infiltrating our illicit drug markets. And, when these episodes happen, it's definitely brings to the public's attention again that, overdoses are not going away. There's still a huge issue. There's still a lot of work that we need to do. But, as someone who's been in the field for a while, it was not surprising. It was more so of something big like this finally happened. Because we know that these things do happen. We know that they're going to continue to happen until we can figure out a way to address the issue.
Daphne, your thoughts about it?
Um, it was a lot. I was like, maybe if more people stop, being like scared to get help and treatment, like this can be prevented. But a lot of people is scared to let the next person know that they use it. They think they're going to get judged by it. But if you go on and get help for your disease, because that's what it is. It's a disease, and they just didn't wake up that morning and say, "Boom, I want to get high." If they start addressing the mental health, a lot of this wouldn't be going on.
Mm-hmm. Dr. Kalia Murphy?
Yeah, I mean, this was a mass casualty event at the end of the day.
Right.
And while, we are talking about the overdose events itself, I also want to focus on the response here. Because as a community, there was a huge response where 27 people got help, right? The people in the community administering Narcan to reverse overdoses, the ambulances coordinating, trying to get the patients to the hospitals. Um, while this was a mass casualty event, I also want to focus that there's a lot of good work that has already happened at a community level that really helped us respond to this mass casualty event more effectively than I imagine we may have been able to do in the past.
Okay, so that's the point that came to mind as you were speaking for me also, is that the city of Baltimore, and I'm sure there are other cities around the country that are realizing that this could happen at any point, that it remains a very critical issue in our communities. And in the Penn North area in Baltimore, Pennsylvania Avenue and North Avenue, that's a main thoroughfare. Stretching, North Avenue goes from east to west all the way across, and they had to shut it down, but they had the resources to address it. But I will also say that 27 people in an area that is pretty much a known open air drug market. You have some people who there may be shame and stigma, but also the reality is that they are addicted. They know they are addicted, and it just demonstrates how difficult it is to break the habit, to break the cycle.
Mm-hmm.
So let me move on to some of these other issues that are really, really important for us to discuss. So let me first, what are some of the most common misconceptions people have about addiction and who it affects, Dr. Cardwell? Because I kind of touched on it early in this conversation, but drill down a little bit more, please.
Sure. So I would say that one of the biggest misconceptions about addiction and substance use disorder is that it's a moral failing, that, people, just want to be addicts per se, that, they use substances because they're bad people, and that, it only affects a certain type of person. I would say, all of those are false. As Ms. Daphne alluded to, we now know that addiction is a disease. It is, we can know areas of the brain where there are actual, dysfunction in these areas of the brain that then reflect in the behaviors associated with their substance use. And because of that, it can happen to anybody. I treat patients from all walks of life. We tend to think of, people who use substances like those individuals that had involved in the overdose, people experiencing homelessness, people experiencing poverty, but there are people who are physicians, there are people who are lawyers, who are dentists, teachers, parents, politicians who deal with substance use disorders. And so no one is, free from potentially developing this type of disorder.
Let me follow up with a question about that, because I know that there are some people, again, who are outside of this issue who often wonder, if this is a disease, are there people who have the disease but never become addicted because they are never physically exposed to substances?
Mm-hmm. So theoretically, yes, we would not know because they've never used, so they've never developed, the physiological dependence that we see with substance use disorder. But we also know that people who, have substance use disorder, the areas of the brain where we see dysfunction, we see in other things. So issues such as gambling. Again, the way that it works in the brain is very similar. Things such as sexual addictions, again, can work very similar. So, any of these, behavioral addictions, if you were to say, we can kind of see the same areas of the brain lighting up. And so, that is one of the theories that, all of these kind of conditions are similar. And there could be people who do have this predisposition, but because they've never had the exposure, they don't develop the disorder.
Dr. Kelly and Murthy, you were nodding your head.
Yeah, I mean, I was just agreeing with Dr. Caldwell here. And I think she mentioned like that one of the misconceptions rather being a moral failure. And I often think of how people think it's a choice. Someone just chooses to continue using drugs or engage in a behavior even though it causes harms. And many times we know that there are certain aspects of neurobiology and brain function which influences how people make decisions, right? For example, I work with kids a lot, and I was thinking of the question you asked, Mr. Fisher, about Are there people who would have like maybe a disease but never really get exposed in their environment to a substance who don't go on? I can think of a lot of kids like that for whom, especially as teenagers who engage in high risk behaviors without thinking of long-term consequences, because that is what teenagers are supposed to be doing at that age. And if they are not in the right environment, or they didn't get exposed to the substances that can then lead to an addiction, or engage in behaviors that can then lead to an addictive behavior. So we need to figure out how to better frame addiction outside of a moral failure, or seeing it as a choice, when people might not have a lot of control over the behaviors that they're engaging in.
Daphne, can you help me with this? What is the difference between, let's say, casual drug use and dependency and full-blown addiction?
So you have our word that we use. You have functional addicts, right? A functional addict can get up, go to work, pay their bills. Whatever they got to do, they take care of it. Addicted addict, just addicted. They work, but eventually they're gonna stop. I'm gonna just talk about myself, right? I was not a functional addict. The only thing that I could do, if I get my paycheck, I blew it up, right? And then when the money was gone, I had to go out on the street and I had to find a means to get more. I couldn't pay my bills. That's why I was in a program where my rent was already paid, so I ain't have to worry about it. But when I decided to put the drug down, before I could do that, I had to get mental help to find out why I really picked up and what was I medicating to. And then once I started going to mental health, I was able to put the drug down, and now, I help addicts. But I see people every day, they go home, get high, and get up, pay their bill, and I'd be like, wow, I can't do that. Today, I can't even take a drink because I'm not going to play with it because it's centered in my thinking. All I have to do is take a drink, and I'm back out there worse than what I was before. But I seen people, and they call them functional addicts.
Right. Yeah. And see, that's the thing, because Dr. Caldwell, we know people, particularly now that we have seen, for example, the legalization of recreational marijuana use, where you may have someone who may use marijuana recreationally once a month,
Yes.
once every 2 months. You may see someone who may say they are social drinkers, and they may go out with the girls for happy hour and barely finish a whole glass of wine. Okay. But then you do have those who are, functionally, functional drug addicts. You may have somebody who is a functional alcoholic, and then you have some who are fully dependent. And like I asked Stephanie, Dr. Caldwell, what is the difference? And how wide is the line between each of those?
Definitely. So when we talk about, someone with a substance use disorder, so then again, so this is a clinical diagnosis.
Right.
The things that we kind of look at, I always tell people 3 C's. So issues with cravings, issues with consequences, and loss of control of the substance. And so, where we kind of delineate between someone just, using, alcohol or other recreational substances in order to actually develop going into a use disorder, are they unable to control how much they use? So, they're not able to stop. They say, oh, I'm going to have 2 drinks, and then they come out every time they have 5. Are they able to cut back? If they are having surgery, if their doctor says, oh, I want you to cut back, are they able to do that? Is it causing problems for them? So because of their substance use, are they having issues with their relationship? Are they having issues with their mental health or their physical health? And then craving. So do they actually crave the substance? So, they're at work all day and they're just like, I cannot wait till 5 o'clock so I can go hit the bar, so I can go smoke, etc. Or they require more of the substance in order to get the same effect. So maybe, when they first start smoking cannabis, They maybe only smoke, one joint a week, but then
Hold
they
on,
need.
Dr. Caldwell. I hate to
Mhm.
interrupt you. I've got to take a really quick break, but we want to
Sure.
come back to your point and so many other questions that we have during this Medical Monday conversation about addiction and recovery. Stay with us. The Daily Drum will continue on Sirius XM, channel 141. The Original Quiet Storm with Raheem Devon is next on WHUR. We'll be back in a moment. Welcome back to the Daily Drum on Sirius XM channel 141. I'm Harold Fisher. We continue our Medical Monday conversation about drug abuse, addiction, and recovery. This is a very important conversation, and we continue, of course, with our guest, Dr. Ebony Caldwell, with the Howard University Department of Psychiatry. She's an addiction psychiatrist and clinical assistant professor. Also, Dr. Siva Kalyamurthy. He's a child and adolescent and addiction psychiatrist, also with Howard University's Department of Psychiatry, as well as Daphne Jordan, a peer recovery specialist and recovery guest at Howard University's Department of Psychiatry. Before the break, Dr. Caldwell, we were talking about the differences between, casual drug use, dependency, and full-blown addiction. Go ahead, finish your point.
Oh, so yeah. So the last point I was making was about tolerance. So, people who need an increased amount of the substance in order to get the same effect. So maybe someone started off with maybe one joint a week, and then they need a joint every other day. Then they're smoking multiple times a week. And then also if someone experiences withdrawal. So we know for a lot of these substances, the body and the brain actually adapt to having the substance in the body. And so after a while, when people go without having access to the substance, they can become either psychologically distressed or physically ill. So, if someone has, issues in any of those domains, that's when we start to see, a transition from, just substance use to actually having a substance use disorder. And of course, there's a severity of it. So there's some people who may only have issues with one or two of those things. And there's some people who might have issues with all of them.
Dr. Kalyamurthy, if you could help me with this question, because even as we look at some of the issues regarding children and addiction, social media, for example, is that the same thing in your mind as substance abuse?
Oh, that's a tough one. I'm going to say yes and no. There are a lot of similarities, just like Dr. Caldwell was mentioning about the control, the consequence, and the cravings. We definitely see those elements when it comes to how kids might use social media, but we can't just clump all social media use into one big category and tell someone has problems with it. We might have to do a deeper dive in that there might be more specific aspects of social media that someone might have a problem with, or the phone itself, or video games, or there's just a lot of technological devices in kids' life, and we have to kind of figure out what aspects of it are necessary, because a lot of kids use tech for school. They use laptops regularly for schoolwork, and then they use it for gaming. So we have to think it's a yes and no kind of answer from me on that specific point.
And that's why I asked, because parents want to know. And when they see the negative impacts, for example, of social media dependency, based on Dr. Caldwell's definition, where if I take your phone, you're craving that, and obviously we're talking about something considerably different from alcohol or psychotropic drugs or the like. But it seems that there is a similarity, and as your specialty is children, how long, or what, not how long, what should parents be looking for when they're considering whether or not their children are having a substance abuse problem, and how young should they look for?
So, in terms of, I mean, there's two questions here. One is social media, and then there's a substance use related
Yeah.
problem, right? So, when talking with parents, many times it often comes down to there's only 24 hours in a day. How much time is your kid spending on this activity online? Because that activity is then displacing hours that they can spend socializing with their peers, engaging in extracurricular activities, sleep, eating. And if any healthy behavior is being displaced, that's definitely a point in which a parent should be concerned about that specific behavior. And the other aspects we see is childhood is a time to learn a lot about how to interact with society. And we often see that kids, when they don't get enough social interaction early on due to increase in screen time, they are missing out on learning skills that help them interact with other people. This might then manifest itself as anxiety and depression down the line. And these kids then might want to self-medicate with substances. Now, one of the challenges we see is most kids, right, like by the time they're 10, have their first cell phone, but they don't have adequate supervision. I often ask parents, hey, you take your kid to a foreign country where you don't know the language or the terrain. Would you let your kid roam around unsupervised? That's exactly what's happening with the cell phone now. Kids are given this device, no supervision, and they have a lot of freedom and access to things that they don't fully understand yet, and there's just more harms associated with that. So when it comes to substances, kids' social media access also increases their ability to access drugs. And we want parents to start talking to their kids about those dangers as early as elementary school. Like there are some schools now that introduce curriculum around substances as early as elementary school. And it's not a one and done conversation. You want to continue talking about it as the kids get older at regular intervals.
Mm-hmm. Definitely, if you don't mind my asking, what was your introduction to drug dependency, and what were you using? How old were you?
I started picking up the little pony beers when I was like 7 or 8 years old because of things going on in the home. So, after they have a party, we'd clean up and they might leave beer and we'd drink it. And it started making me forget about what was going on in the house. So eventually the beer stopped working. So I went to weed, and then weed wouldn't work no longer for me. I tried PCP. I kept lunching off of PCP. So then I tried heroin, and it made me feel good until I started nodding, and I didn't want my kids to see me like that. So I stopped using the heroin. But when I got hooked on cocaine, it rolled my back for like 25 years. It wasn't easy to put it down because I had so much pain that I had went through when I was younger, and I wasn't able to talk to nobody about it. But long as if I had something to take that thought or feeling away, then that's what I use. And cocaine worked for me for 25 years. It just medicated me and kept me numb to things that happened to me when I was a child. That's why I talk to my grandkids and great grandkids. I talk to them about whatever go on. I want my granddaughter, I want you to feel that you can come to me and you can talk to me, because at the time when I was coming up, they used to say, what you see here in this house, when you leave here, you let it stay here. And that damaged a lot of us because we couldn't talk to our parents about our uncles or brothers or somebody fornicating with us or molesting us. I couldn't talk to nobody. So I had to keep all that a secret. And it just worried on me. So I just turned to drugs.
Mm-hmm. You said earlier that before you could get clean, before you could put the drugs down, you had to first deal with therapy. And that is such a big issue, particularly in the Black community, because even in 2025, you still have Black people who say therapy is for white folks.
Yeah.
So how did you cross the bridge into deciding that you would go into therapy?
Honestly,
Yeah.
God had put a lot of special people in my path, like guardian angels they was. And I started looking at how people was living, and I wanted what they had. But I knew first I had to find out why I was getting high. But my mom, she did that type of work, and she used to always tell me that when you have mental health, it doesn't make you crazy if you see a therapist. So that's the thought that I kept. So while I was seeing this therapy, I was keeping in mind that I'm not crazy. So when I go out in the community and I talk to clients out there in the community, I tell them, you need to see a therapist, but that doesn't make you crazy. A lot of people think a psychiatrist and all that, it makes you crazy. But I experienced it. So I'm able to get my experience out. It doesn't make you crazy. It makes you get better with yourself. And once you get better with yourself, you can start coming up off of that drug. And that's what I did. And when I found out that I was getting high because I got molested and stuff was done to me when I was young, I was able to forgive that person and forgive myself. And I was able to, today I'm coming up on 15 years clean. I don't need nothing to make me feel better, but going to church and working with these fabulous doctors, I love it.
Yeah, there is a lot of work that needs to be done to help you get through the work.
Yes.
But Dr. Caldwell, we hear so much about the opioid crisis. Do you believe that is the biggest threat to communities at large, and specifically even the Black community, or do you think that there is something else that is impacting addiction in our communities?
Well, I would say twofold. I would say the opioid epidemic is impacting our community in the sense that our community is dying from it. So when you look at the Washington, D.C. area specifically, 90% of those who have fatal opioid overdoses are Black. And so, we cannot ignore that the opioid overdoses are impacting our community. But I don't think it is, the root of the issue. It is a sequelae. I think at the root of a lot of our issues are what I believe is the actual gateway drug, which is traumatic experiences, which is trauma.
Really?
So many of our patients, have stories very similar to Miss Daphne. It's not that, I started smoking weed and then all of a sudden I was using cocaine or heroin. Is that something traumatic happened to me? I did not have support in my family. I did not have anywhere to go. I was, neglected or abused or whatever. And then in order to address that, I turned to substances. And so I would say that, that is probably the biggest factor in our community, is that we have a phrase called a term called ACEs, so adverse childhood experiences. So these are things that happen to a child in the formative years that we know increase their risk of developing things such as mental health disorders and addiction. So I think as a community, if we can start to address those adverse childhood experiences and decrease the rates of those, then we can see a decrease in mental health issues and as well as substance use.
So help me with this then, Dr. Caldwell, because growing up in the DMV, I remember when it came to public service announcements and other educational tools on television about the dangers of drug abuse. And I'm dating myself. I'm not talking about during the 80s. I'm talking about during the 70s, that there was always this slick person who was walking around the neighborhood offering you drugs and tell you that it's going to make you feel better and to try it. But based on what you're suggesting is that if trauma was the gateway drugs, was that a myth based what I saw on television and the like? Was that a myth or was it a half truth or what?
So I would say that, most people probably, especially with teenagers, usually get substances from their friends. So friends or family. So it's, a friend, let's try this, let's experiment. And again, experimentation is normal. That's a normal thing that teenagers do. One issue is that the things that they're experimenting with are not the same things that we were seeing in the 70s, 80s, 90s, or even 15 years ago. Kids are experimenting and having overdoses, some of them fatal. Kids are experimenting with, marijuana that is literally, 10, 20, 50 times more potent than, cannabis marijuana was, 10, 15 years ago. So the things that they're accessing are so much more dangerous than, what, probably even I experienced when I was growing up. So, that's one issue. And then, kids are taking things that they think are, might be a Xanax, which again is a medication that are prescribed for anxiety, but it's not a Xanax. But they don't know that it's not a Xanax. Their friend doesn't know it's not a Xanax. They might have got it from someone who said it was a Xanax, and now they've had an overdose. So, there's just all of these different dangers that we necessarily didn't see before because of the infiltration of the drug market.
Mm-hmm. Walk me through, if you can, Dr. Kalliamurthy, about what a modern recovery program looks like, one that has a track record of working, because I'm assuming that just like all people who need to be in a program, all people who are addicted are different.
Yeah, so we really need to meet people where they are. We kind of walked away from this concept of forcing people into treatment, and we really need to identify where they are in their stage of addiction or recovery and try to meet them at that point. We need to offer them flexible solutions, right? It's hard, like, take me, like, I need to go to a doctor's appointment. The amount of logistics it requires to move my work around and other stuff, like, I hardly go to the doctor because of that. And then we have high expectations of our patients who may have two jobs.
We're going to have to get you on our show about getting men to go to the doctor. That I make sure I call you about that. I don't need to hear any medical problems from you, but please go ahead.
So exactly, right. It's hard, like, even for someone who doesn't deal with addiction, to kind of figure out their health needs. And then we have people who struggle with addiction who have, like, biological reasons for why they struggle, and we set high expectations of them to enter treatment. And then to stay in treatment, we set even higher expectations, right? Okay, so we know that given it's a chronic disease in nature, that return to using a substance may be part of the recovery journey. But then you have programs who have historically then discharged people if they went back to using, and that didn't make sense. So we need to adapt where, okay, so if someone returns to using substances, how can we get them back on track? How can we provide evidence-based medications, evidence-based therapy, help people stay engaged in care through using our, like, Miss Jordan is a great example of this. Like, she will call our patients and trying to make sure that they stay connected, know what their troubles are in coming to the appointment, and try to solve those problems for them, and continue to adapt. And everyone's recovery journey is different, and we need, as physicians, we then figure out how can we partner with our patients so that everyone's an expert in their life. We have some expertise and knowledge in recovery, and we need to make both those things work together at the best interest for our patients and our communities.
Definitely one of the things that I often think about that we saw in the movie New Jack City, again, I'm dating myself, where Chris Rock's character was talking about his cocaine addiction, and he kept saying, keeps calling me. And a lot of people, that even in those few seconds, have been very, very accurate when you talk about cravings and the like. And so to continue, that metaphor, when it's calling you, how do you not answer the phone?
I can tell you how I did it. Okay, so once I got the therapy help, I started going to meetings, right? And they started giving me suggestions. And the smallest thing that made so much sense didn't make sense to me when I was out there. If I didn't bend my elbow, it wouldn't get in my mouth. You know what I'm saying? So when they told me that, I was like, what? Because I'm the one that's putting it in me, so I got to bend my elbow. So when they told me that, I knew then that it took me to pick it up, right? But in order for me to get help, I had to go and go to meetings. I got a sponsor, right? And the sponsor guided me in a book that we use. It's called a workbook. It's called Step Work. And with that step work, it's just like you going to a psychiatrist, but I had finished my therapy, but I still need long-term care for my addiction, right? Even though I had addressed the issue, now I got to address this problem. So I had to go to people that were suffering from the same thing that I was suffering from and wanted the same thing out of life. They wanted to stop just for the day. So I had to remember, if I just say just for the day and I stay in the day and don't worry about tomorrow, I won't overwhelm myself. So the suggestions they was giving me was suggestions that I started using. I went to 90 meetings. I had 90 days clean. And I was like, wow. And then I seen them like, everybody with a year more, raise your hand. And I was like, I want to raise my hand one day. So I just kept coming back until I got that year. And then once I got that year, I knew that, I'm going to have to continue going to meetings. My disease is going to be sitting in my thinking up until the day I die. So even though I work with all these doctors, I'm in college now, I go out and I help suffering addicts, I still go to meetings. I went to one this weekend, a marathon. I still go because I still got to keep in touch that my addiction is out for my life. And that I use again, that I might get hold of fentanyl. So I got to keep going to meetings. I got to keep telling Dr. Caldwell, Dr. Calvin Murphy, I go to them and I be talking to them and I be smiling and I got to keep letting them know how I feel. Because if I don't let somebody know how I'm going to feel, eventually I will use. So if you step on my toe, I got to tell you, you stepped on my toe. Because one thing about addicts, we keep a lot of stuff in, right? But if we learn how to talk about what's going on with us, we start cleaning ourselves out, right? And I have a pastor that ministered to me. So, I'm covered on both ways. I'm covered with the fellowship. I'm covered with these doctors. And first of all, I'm covered with God, right? But when I go out into the community, I love it. I got a poster with my picture on it when I was using in One Clean. And I tell people that's out there suffering, that's me. And they be like, what? Yeah, that's me. I didn't always look like this. I could hide behind a lamppost. You would have knew I was there. Because I used to live and I lived to use. That was my thing. I had kids. I ain't really take care of my kids. So I tell them my experience to let you know that you're not the only one that's abusing people that love us. But now my kids support me, so I love my job. I love working with these doctors and I love helping the person that's still suffering because I feel that's my calling, right? To go out there and help somebody that's suffering with addiction. So that's why I'm sitting here in front of you. And before we get off this call, I'm going to give you our phone number where they can call me and get the help that we offer.
Well, actually, you can do that right now. And I'm glad that you brought that up because I will post the phone number and also any websites that anyone wants to share. And so I think this is a good time to do that. So definitely, please go ahead.
Okay, so the number is 202-649-0359. I will answer the call. I don't care what time it is. If they call, they want Dr. Calvin Murphy or Dr. Caldwell, I always will send them an email and let them know that somebody asked and inquired about them. So their information will not stay stagnant. I will address it, and I will, and the doctors know I'll keep on bugging them, right? Because I was once there, so that's why we're a team.
So that's 202-649-0359.
Yes, sir. That's it.
And that's the number to
my heartline.
Your heartline.
Yes.
Your heartline. Okay. Well, get ready to stay up late because the other thing, Dr. Caldwell, and I think this is also particularly important, and I'm short on time. What role do you believe that shame and stigma have in preventing people from seeking services?
I think shame and stigma are a huge hindrance to people getting care. I think, We shame people in the ways that we treat people who use substances. So, prior to this opioid epidemic, we did not have a medical approach to addiction. Our approach to addiction was sending people to jail.
Yeah.
And so, if that is, the mindset that we as a society had, it's going to take a long time for us to shift that dynamic. And so, it'll be a while before we really see that people see addiction as a disease that needs medical intervention, support, recovery, and that sort of thing.
Dr. Callie-Murphy, as it relates to this topic, I'll let you have the last word, your final thoughts, sir.
I think as a medical establishment, we also have to do better. So for me, it's like working with kids, I often wonder, hey, how often did a pediatrician ask a kid or screen them for substance use, and what kind of information did they give? Would that have helped that young child with trauma prevent the progression of that young child with trauma from just experimenting to a problem use? So again, that shame and stigma also, it comes from the medical community many times, and we have to do better as a medical community. But the takeaway from me is that help is available. I mean, just sitting here and listening to Ms. Jordan, I had goosebumps just given what she has faced and how she has overcome that and the place she is in today. And that shows us that there's hope, there's help, and we now have more help than we've ever had in the last few decades. So we just need to find ways to connect with people and bring them in, and that they're not alone.
Well said. Is there a quick website that you all can share that I can also post on our website for those who are looking for help?
Oh, sure. So I put in the chat, but it's the easiest way is tinyurl.com, and then it's HU Community Psych.
HU Community
Psych.
Psych. PSYCH. Yeah, help me with my spelling. HU Community Psych dot.
Oh, so that's tiny URL. So if you if you type in tinyurl.com, and then it's just /HU Community Psych.
tinyurl.com /HU Community Psych.
Right.
Well,
and then I also wanted to emphasize that we do have a walk-in clinic on Monday, Wednesday, and Friday from 8:30 to 10 a.m. So if there's anyone who's in acute need of addiction services, they can walk in Monday, Wednesday, Friday from 8:30 to 10 a.m. at 530 College Street.
530 College Street. Thank you. I'm going to post all of this on our website, and hopefully it will help someone. Thank you all so very, very much.
Thank you.
Daphne, thank you for your full circle story. I think it is inspiring, and it will help someone. Dr. Callie-Murphy and also Dr. Caldwell, thank you so very much. I appreciate your time.
Thank you for
having us.
That is the Daily Drum for this Monday, July 21st. I'm Harold Fisher. Good night.